Hello everyone, this is Professor T.V. Kattimani, Vice-Chancellor, Central Tribal University of Andhra Pradesh, which is in Vijayanagaram. 19th June is World Sickle Cell Day. We should know what is sickle cell disease. Actually, sickle cell disease is a group of conditions in which red blood cells are not shaped as they should be. Red blood cells normally look like round discs, but in sickle cell disease, they are shaped like sickles or crescent moons instead. Sickle cell disease is a hereditary disease and fatal in nature. Globally, this disease is killing thousands of youngsters around the year. The sickle cell disease has been reported widely in Africa, Jamaica, and Central India, Saudi Arabia, where tribal people are there, Negroids of America and Britain. This disease prevalence in India, we can call it sickle cell belt states like Andhra Pradesh, Chhattisgarh, Gujarat, Karnataka, Kerala, Maharashtra, Madhya Pradesh, Telangana, Tamil Nadu. Some states are affected like Arunachal Pradesh, Assam, Bihar, Goa, Jammu and Kashmir, Ladakh, Manipur, Tripura, Uttarakhand and Uttar Pradesh. Sickle cell is particularly prevalent in scheduled tribe populations who are the most socio-economically disadvantaged and marginalized communities located in difficult to reach rural areas, pahadi areas we can say, lack access to good education as well as health care, mostly dependent on government for health care or on tribal local healers. Tribal population in India is estimated at about 120 million people. It means 8.6%. To the change, difficult to reach, difficult to diagnose and treat, difficult to counsel. Socio-economic impact of sickle cell anemia on children, 20% children born with SCD, sickle cell disease, die before 2 years of age, as reported by ICMR, and children with 30% with SCD die before reaching adulthood. Children with sickle cell are at risk of frequent infections. As they age, they experience delayed growth and other development problems related to vision. Especially in adults, the average life expectancy in India is only 48 years. Patients with sickle cell disease are constantly fatigued and experience painful swelling of hands and feet. The major clinical manifestation among people with SCD is vaso-occlusive pain crisis. Apart from the health applications faced by people living with sickle cell disease, there is stigma associated with the disease. People with sickle cell face racial discrimination, community fear and mistrust, inability to manage disease due to incomplete knowledge, occupational complications. Identify gaps and challenges in sickle cell prevention, treatment and management. Awareness, poor understanding of the disease and large population is unaware of its cause and the need to attend screening. Many tribals have common beliefs, traditional customs, myths, practices related to health and disease. There is need of dedicated efforts to make tribal population aware about transmission and control. So, access to healthcare and specialty care, gaps in availability of diagnostic and treatment at PSC and CSC in tribal areas. Without diagnosis and comprehensive care, children suffer crippling medical problem leading to lack of education, employment opportunities and integration into society. Database of sickle cell patients and carriers The state governments, NGOs, Ministry of Tribal Affairs, Health have undertaken various screening programs in different pockets across country. However, there is no state level or central repository of such data. Urgent need of create mechanisms so that after screening the data of a SCD or carrier can go to a central database and can be used for the database planning and monitoring at district, state and national level. Training of paramedical and medical staff. We need to create a big number of paramedical people. Primary care physicians are often unable to manage a pain crisis or the typical needs of a sickle cell patient. When they refer patients to a district hospital due to lack of hematologist and a general physician instead of manages the case. There is need of training of paramedical and medical staff so that they can diagnose, treat, monitor and manage complications of sickle cell diseases. Clinical treatment. The prevalence of sickle SCD is very high among many tribal population groups in India, and they are unable to bear the expensive treatment and medical care. Hence, cost-effective treatment is needed. A focused approach to sickle cell disease at Ministry of Tribal Affairs, central government. Ministry of Tribal Affairs was set up in 1999. It is the nodal ministry of overall policy, planning and coordination of programs of development of scheduled tribes, the most underprivileged of the Indian nation. Abhay Bhang Committee, an expert committee in the report in 2018 on health, tribal health, has listed sickle cell disease as one of the 10 special problems in tribal health. The committee has suggested constitution of National Tribal Health Council, Tribal Health Cell and National Tribal Health Roadmap for dealing with tribal health issues. MOTA, Ministry of Tribal Affairs, under their STC component works with MOHFW, ICMR and DST in a coordinated manner to provide maximum awareness and quality healthcare through decentralized healthcare delivery system. So, we need to develop a specific roadmap for sickle cell prevention and management. Number one is awareness. Number two is diagnosis, targeted population screening along with confirmatory test and its database. Training and its modules relevant to different categories, work allocation of different government departments and fundings. At the same time, we need to graduate, educate the society, educate the parents and continuous research and continuous innovation and e-registry too. Collaborative efforts of Ministry of Tribal Affairs, DGHS and MOHFW and others line ministries. Awareness program in schools, colleges, through school education program, even this disease, related to this disease, textbook lessons should be included. Enhance knowledge building and skill of targeted audience at each level through training. Appropriate guidelines for different level of healthcare like PSC, CSC. Ensure availability of diagnostic facilities at each level and their proper training to healthcare people. Strengthen diagnosis with the help of self-help groups, voluntary organizations, NGOs, institutions, universities, central universities, IITs, ICERs. These people should be properly trained to take up management of the disease at each level, district hospitals, including sickle cell competency centers at each IIMs and territory care. Strengthen data management system for effective monitoring. Enhance AS, These three A's are availability, accessibility and affordability for quality services for benefits. It is delivery of quality services and benefits. Extend support for innovative outreach model to connect secondary and primary care centers. Promote research on newer therapies, drugs like and innovations for treatment and management. Accelerate partnership and engagement of government agencies, private sector, pharmaceutical companies, research agencies, development agencies, not-for-profit organizations. Enhance awareness, screening and counseling. We have to create awareness through school education while adding chapters in school curriculum. Screening of 30 million tribal, including pregnant women, year over the next 3 years, along with CSV testing. During pregnancy, inclusion of testing of sickle cell as compulsory test during first trimester. Providing kit for diagnosis of sickle cell using point of care POC tests. Establishing sickle cell competency centers at territory care having facilities for prenatal diagnosis including counseling and medical termination of pregnancy. Newborn screening, newborn to be screened in high prevalence areas at district early investigation center. For example, Dindora district of Madhya Pradesh, there we have to take it up as a model testing agency. School and adolescent screening, screening of population below 25 years of age and maintaining database of sickle cell carriers and patients. Training, advanced treatment and rehabilitation. See, preparation of technical training modules we have to work out. Designation of nodal institutes for training and referral mechanisms. Initiation of training of medical and paramedical staff, health workers and others as well as NGOs, institutions, teachers, research scholars, panchayat members, self-help groups too. ICHH centers at district level for treatment including the blood bank facilities with advanced technologies like ABD pad and molecular testing at the blood bank level. Referral mechanism at territory care. Telemedicine facility. Inclusion in Disability Act 2016, teaching them skills to be self-sustainable. Research and innovation, we need to know the importance of this domain. For advanced research on gene editing, multiple diseases, one platform for genetic correction. CSIR, IGIB, New Delhi, they are working on it. Indigenous Make in India, CRI, SPR products. Clinical trial pipeline with AIMS, New Delhi and other eminent clinical research institutes of our nation. Research in yoga-based therapies, introducing innovative technologies, data generation and maintain the e-registry through mobile applications. E-registry, see, we can impact-oriented counseling and clinical evaluation are an integral part of the testing and screening process. One-stop solution, all data, patient, counseling, clinical in a single repository, eliminating physical registers. On-the-go training, app trains health workers on the job. Step instructions provided within the app. Offline support, the app can work and store data offline and can sync with server later. Real-time cloud, cloud connected real-time tracking and reporting of tests accessible from anywhere. Multilingual app should be available in many regional languages. Of course, they are available in limited number of languages. Impacts. The ultimate objective is to create access to treatment and improve patients' lives in addition to reducing mortality. Numerous studies have shown that child mortality can be reduced if early diagnosis is done and simple prophylaxis treatment is given, preventing further spread of disease. Sickle cell disease is a preventable disease if early diagnosis is done with good genetic counseling. No newborn with sickle cell disease. Thank you.